typical vaginal discharge is usually thin, clear, or milky white with a mild smell. It changes throughout the menstrual cycle, but during pregnancy, it increases and might vary in thickness, frequency, and amount. Pregnancy can be as exciting as it is confusing, and it's not always easy to figure out which changes are normal and which might be a concern. One of the earliest signs of pregnancy is more vaginal discharge, and this continues throughout your pregnancy. What to expect when you're pregnant? Your vagina kind of develops its own personality, says Dr. Cheryl Ross, an OB/GYN. Vaginal discharge, also known as leukorrhea, can start changing as early as 1 or 2 weeks after conception, even before you miss your period. As the pregnancy progresses, you'll probably notice it more, especially toward the end of pregnancy. You might want to use an unscented panty liner, but don't use tampons while pregnant. In the last few weeks, you might see discharge with streaks of thick mucus and blood, called a show. This is an early sign of labor and nothing to worry about. What causes these changes? Vaginal discharge changes during pregnancy because of fluctuating hormones and changes in your cervix. As the cervix and vaginal walls soften, your body produces more discharge to help prevent infections. Near the end of pregnancy, your baby's head might press against the cervix, which can also increase discharge. When to call your doctor? Let your healthcare provider know if your discharge seems unusual. Some warning signs include yellow, green, or gray discharge is strong, bad smell discharge with redness, itching, or swelling. These could signal an infection, like a yeast infection, which is common in pregnancy. Your doctor might recommend a cream or suppository. To avoid yeast infections, wear loose, breathable clothes. Choose cotton underwear. Keep the genital area dry after showers, swimming, or workouts. Add yogurt or fermented foods to your diet for healthy bacteria. And normal discharge can also be caused by STDs or pregnancy complications. For example, bright red discharge over an ounce could mean placenta previa or abruption. Call your doctor immediately if that happens. When in doubt, contact your doctor. Take note of when the changes started and any unusual characteristics. They can help determine if it's serious.